Hello, my name is Asaf. I'm an RCSI Bahrain 2017 alumni. Adriana asked me to record this voice note and talk about applying to a residency program in Germany. So in Germany, there's not like a set match system as there is in the US or other countries. In Germany, every city has a set of requirements that you need to officially translate by a certified translator and then get them copied and attested at some place called the Ausländerbehörde and then sent to the Bezirksregierung. You can get a set of these requirements from the Bezirksregierung website of the city that you wish to apply in. So every city has a website, basically the Bezirksregierung's website, and it has a set of requirements with the application that you need to fill out. The language requirement is different from one city to another or from one area to another. According to the city you're in, you're required to have B2, which is B2, or C1, which is C1, which takes about 8 to 10 months. Once your papers are processed by the Bezirksregierung, you get an email from them, and they usually ask you to provide them with more papers depending on your situation. Every case is different depending on your nationality, where you live, where you graduated from, and where you did your internship. In Germany, if you did your internship in a different country than the country you graduated from, can sometimes be a little problematic, but usually easily solvable. Now, once you provide them with everything, they ask for your papers to be sent to a Ärztekammer. They actually send it themselves. And then they contact you to schedule the Fachsprachprüfung, which is the medical language exam in German. It's an OSCE exam divided into 3 parts. First part is you taking anamnese, which is history from the patient. Second part is the Anamnesebogen, the documentation, which is you basically writing down the history in certain form of German. And they give you 20 minutes for that. And then the third station is erste Gespräch, which is you discussing the patient with a physician. There are excellent language schools that provide you with preparation courses, which I recommend obviously you take. And you should always make friends in that course, take past exams from them to review them. It's very helpful to do that. Now, if you graduated from Europe, you don't have to do any further medical exams, just the Fachsprachprüfung. And once you pass the medical language exam, you would be eligible to get a license to practice, which is the Approbation, which is what you're applying for in the first place. However, if you graduated from outside of Europe, you can waive the right to have your university curriculum checked and basically just take the Kenntnisseprüfung, which is a medical exam in German. Or you can ask for your curriculum to be examined by an expert. You ask the universities to send you the curriculum description, and you send that. You don't have to translate it as long as it's in English or German, obviously. But if it's in English, you don't have to translate it. You send it to the Bezirksregierung, and you ask them for a Gutachter, which is an expert, to take a look at the university curriculum. And in your case, depending on the university you graduated from, it can be, the Kenntnisseprüfung can be waived. But of course, you have to pay to get that done. If you do have to do the Kenntnisseprüfung, but you have passed the Fachsprachprüfung, which is again the language exam, you get a temporary license for 2 years in which you can practice and then do the Kenntnisseprüfung in the time span of 2 years. Once the Kenntnisseprüfung is done, you can get your license. But if it's waived, once the Fachsprachprüfung is done, you can apply to get your license immediately because the Kenntnisseprüfung was waived. Obviously, everything I said in the voice note applies to the city of Düsseldorf and the area of North Rhine-Westphalia in Germany. Other areas might be different. But in general, once you have done the Fachsprachprüfung, again, the medical language exam, you can start applying. There's no set application where you can apply to hospitals here. There are websites where you look for free spots and you start applying to hospitals and clinics that you can work in, and usually get multiple interviews, and you're able to find a spot relatively easy. Obviously, it's not going to be that easy, but relatively easy. You can find a spot in the specialty that you wish. And that makes it even easier for you to do the Kenntnisseprüfung if you eventually have to do it. If there are any questions, I'm happy to answer them. Best of luck.